I was diagnosed with endometriosis. So when the doctor diagnosed me with the condition, she prescribed some type of medication to make the symptoms better. And as the years passed, my condition was getting worse. That's when I visited Dr. Salivad, and he recommended to do a hysterectomy.
Endometriosis is where some of the glands of the uterus are found elsewhere in the pelvic organs. It causes a lot of inflammation and adhesions. In this case, Diane met all the criteria to approach her disease with a robotic, minimally invasive approach.
Robotic surgery is a form of doing minimally invasive surgery for patients that have gynecological issues, general surgery issues, or urology issues.
The robotic system involves a console-driven or surgeon-driven robotic arms that sit on top of the patient. The small incisions that are made are approximately the size of a dime. There's 2 to up to 5, depending on the disease, that are made in the patient's abdomen.
We have to send the physicians to a training facility for a day, and then they come back. They have modules that they need to learn on and be able to finish those modules.
This is what she looks like. Like I say, I have $100,000 in my hand.
I began training in the robot back in 2010. Began training through Intuitive. Have attended 2 advanced courses and 2 master's courses in my particular field, and I've done over 300 plus robotic cases that involve both cancer and very complex abdominal or pelvic surgeries. So part of the deal is getting the robots and the ports located like the way you want the procedure to go. So depending on the type of procedure, the trocars have to be set to the specific anatomy. Almost exactly like a laparoscopic approach, but it's much more comfortable for the physician, and there's a lot less movement with the robotic arms versus laparoscopic arms. So it's obviously less pain at the incisions. The recovery is faster. They usually go home the next day. There's less blood loss because of the precision of the instruments, and there's better view of the inside because of the 3-dimensional aspects of the cameras. Interestingly enough, she was our first robotic surgery performed here at University Medical Center, and she went home the next day with very minimal discomfort.
I thought it was wonderful. I didn't have I had pain, but not like excruciating pain. I was able to eat right the same day. I was able to stand up.
So I did my training, my residency here in El Paso. I went off to do my fellowship training at MD Anderson and the University of British Columbia. I knew deep inside that I've always wanted to come back and take care of this patient population. Oftentimes we have patients that go to big cancer centers like Cancer Centers of America, MD Anderson. But one thing that personally have been associated with is the talent here in El Paso, here at University Medical Center and Texas Tech. I want to tell patients that for the majority of cases, at least in my field, and for example colorectal, there is no need to travel elsewhere. You get high quality care here at both Texas Tech and the University Medical Center. The hospital that they just built, both the children's and women's, is in tune with the latest technology, the state-of-the-art equipment, brand new rooms, brand new facility, and I think we have top-notch doctors here so that patients do not need to travel elsewhere and burden themselves and their families.